When you or your child come in for a Baclofen Pump refill, here's what to expect. You will be roomed and have relevant history taken like any other appointment. The patient will be instructed to lie down on the bed and expose their abdomen. This is what a Baclofen pump looks like. Here's the refill port. Here's the side port. And this is the catheter coming off of the pump, which would then extend to the patient's spinal cord to deliver the medication intrathecally, meaning directly to the spinal cord. The Baclofen pump will then be interrogated with the tablet. This shows all the information regarding the Baclofen pump: the current dosage, the volume expected remaining within the pump, the drug concentration, and the alarm date. The staff member performing the refill will assess if any dosage changes are needed and confirm the concentration of the drug and volume expected remaining. The concentrations available of Baclofen are 500 micrograms per milliliter, 1,000 micrograms per milliliter, and 2,000 micrograms per milliliter. Now the procedure part begins. The sterile Baclofen pump refill kit and medication in the correct concentration will be at the bedside. The refill kit contains sterile gloves, a template to assist with locating the refill port, a sterile drape, empty syringe, 2 needles, a catheter, multiple sterilizing agents, gauze, a Band-Aid, and a filter. If the patient has any concerns of discomfort during the process, topical lidocaine or cold spray may be utilized prior to the refill to decrease sensation and discomfort during the refill process. The staff member will palpate the patient's abdomen to feel the rounded edge of the pump and cone-shaped side port. These landmarks are used to line up the template within the refill kit to make locating the refill port simple. If the rounded edge and cone-shaped side port are difficult to appreciate alone on palpation, the staff member may utilize ultrasound to better visualize and mark the location of the refill port. After palpating the pump or utilizing ultrasound, the staff member will put on sterile gloves, clean the pump site in sterile fashion, and then place the sterile drape over top. This allows for the refill to be done as clean as possible, decreasing risk of infection. At this point, the staff member will place the template over the top of the pump. Once the refill port location is determined via palpation with template or ultrasound, the staff member will connect an empty syringe with the catheter tube and needle. They will then push the needle through the skin into the refill port of the pump. At this point, the clamp on the catheter will be undone, allowing for drawback of fluid. All of the fluid remaining in the pump will be withdrawn. After withdrawing all the fluid, the catheter will be reclamped and the syringe now containing the withdrawn medication will be unconnected from the catheter and needle. The needle will remain within the refill port throughout this time. The new medication will now be attached to a sterile syringe and then connected to the catheter and needle. The catheter will be unclamped and the new medication will be pushed into the pump reservoir. If the pump is the larger model, 40 milliliters versus 20 milliliters, then 2 syringes of medication will be used to refill. Once the refill is finished, the catheter is reclamped and the syringe, filter, catheter, and needle are all removed from the area. Everything will be disposed of appropriately and the patient's abdomen will be cleaned. If the patient is having any bleeding at the refill site, a Band-Aid will be placed. Following this, the pump volume will be corrected on the tablet and the communicator will be placed upon their abdomen again to update the pump. The refill process is now complete, and you will be provided with a new clinic appointment corresponding to the new alarm date to ensure the pump is refilled prior to that time. If you have any questions, please reach out to the clinic.